Come in.
How you doing today?
I'm good. How are you?
So my name is Mike. I'm going to be your nurse today. Who are you?
This is my cousin Joe. Is it okay if he stays here for support?
Yeah, no, I think it's great that you have some moral support while going through some difficult times here. So I took a look at your chart, and it seems that you did test positive on the CA-125. That isn't a direct indicator of ovarian cancer, but it does mean that there is some activity going on in there that is cancerous. So we're going to be doing some additional testing, like a CAT scan, just to see what's going on under there.
If it becomes clear that Alex does in fact have ovarian cancer, could you go over some of the possible treatment options for us so we can better understand them?
Yeah, so that's going to depend on the results of the testing done. Surgery is going to be an option, but we also do have medication that could treat ovarian cancer.
What types of medication can we expect? Because it seems like that's the more reasonable route than invasive surgery.
Yeah, so I actually brought with me something about Bleomycin. So Bleomycin is an anti-tumor antibiotic that is used to treat cancer. This drug is cytotoxic, which means that it's going to be harmful to your normal body cells. Bleomycin is shown to have anti-tumor activity by selectively inhibiting the synthesis of DNA. So in layman's terms, it will bind to the cancer cells' DNA so that the cells can't divide or grow. But the purpose of it is just going to be to make sure that the cancer just can't keep growing inside your body. We're going to do this by IV, or we're going to do an injection into your muscle or skin. So do you have any questions?
No, it sounds like that it's going to kill the cancer cells.
So what you're saying is Alex is going to be started on chemotherapy. I've seen what chemotherapy can do to people. Could you go over some of the possible adverse reactions or side effects for this?
So if we do end up going with Bleomycin to treat the cancer, you're definitely going to notice signs of some weakness. But some other common complications are going to be fever, chills, maybe some skin reactions, some reddening of the skin, possible stretch marks. You're going to want to make sure to check out your nail beds, make sure they're not thickening, and you also may experience some hair loss. But the main complication that we've seen is going to be pulmonary fibrosis. And as I said before, this drug is cytotoxic, which means it's going to kill the good and the bad cells. So since it's killing the good cells, it could affect your lungs as well. Oh, come in. Oh, so this is Kevin. He's our respiratory therapist, and we're actually just about to go over the adverse reactions of Bleomycin.
Okay. So as Mike mentioned, my name is Kevin, and I'll be your respiratory therapist. So I understand that if you are diagnosed with ovarian cancer, you'll be placed on Bleomycin. Is that correct?
Mm-hmm.
Okay. So just to give you a brief explanation, I'm the respiratory therapist, so I'll be pretty much very mindful of your respiratory status while on this medication therapy. So certain things that I'll be monitoring for is dyspnea, which is pretty much shortness of breath. And I'll be periodically auscultating or listening to your lungs for any abnormalities such as crackles. I'll also be monitoring your chest x-rays. So I'll be monitoring them prior to the medication therapy as well as periodically on a weekly basis. I also would like to inform you that a side effect is pulmonary complications. It normally tends to happen in geriatric patients who are above 70 years old, or anyone who has used the drug and over 400 units. I also would like to mention that pulmonary complications may occur between 4 to 10 weeks while on the medication. If this tends to happen, if you have any pulmonary complications, we'll just stop the medication and pretty much find an alternative treatment. Do you have any questions?
It sounds really scary. What are the chances of my lungs just giving out?
Okay, good question. So, like any medication, all medications have side effects. And Bleomycin is a drug, it's a toxic drug that kills cancer cells. So, pretty much with this medication, we'll do a full and thorough assessment for your current medical history, your allergies, we're trying to decrease the level of unnecessary risk. And that's why we're here to closely and do our due diligence to closely monitor you to pretty much decrease any of these side effects that may occur. To prevent any of these, like I mentioned, we'll do a full thorough assessment. And of course, we'll be here for you every step of the way if you have any questions or concerns.
What are some things you guys do on your end to prevent other complications, such as giving too much or not giving enough, or if she can't tolerate the treatment?
Okay, so prior to starting the treatment, we'll give you a testing dose. So pretty much it's 1 to 2 units of the medication, and we'll monitor you from 2 to 4 hours to see if you have any anaphylactic reactions. Also, we'll pre-medicate you with acetaminophen or corticosteroids, which pretty much help like reduce fever. I'm pretty sure you know what acetaminophen is. You can buy it over the counter. It's to reduce any fever or any like allergic reactions. Also, prior to, as I previously mentioned, prior to you being placed on the drug, we'll definitely do our thorough assessment to make sure that you are a good candidate. Sadly, what tends to happen are some medication errors. So to prevent these medication errors, we would obviously double check and clarify the order. We will make sure that we're double checking the daily dosing and the therapeutic dose limit. And we'll also have another prescriber making sure that they're clarifying the order and the dosing limits as well.
Sounds like you guys know what you're doing. This has been informative. Thank you.
So during the course of treatment, it's important that you notify us if you're experiencing some adverse reactions. So with the fever and chills, maybe some excessive sweating, shortness of breath, that we need to know this because we might have to stop treatment and give you some other medication to help you out with that. So if you are smoking, you need to make sure to stop because it could worsen the pulmonary side effects. So there also is going to be a possibility of hair loss, so you guys might want to look into some possible wigs. And if you're having any difficulty eating due to pain or discomfort, we can administer some pain medication to help keep you ready to go. And if you're taking any multivitamins, herbs, any kind of extra supplements, we need to know that. We need to know what's going into your body right now.
Wow, this is a lot to remember. I don't know if I can do this.
I'm here for you, Alex.
Yeah, I can imagine. So I'm going to ask you a couple questions right now to make sure that you understand everything that's going to happen to you. So what do you think you can expect from treatment with bleomycin?
It's a cancer drug that kills cancer cells and normal cells. I might have some allergic or pulmonary complications, and I might lose my hair.
Okay, all right. So at what point would you notify us of these adverse reactions?
If I had fever or chills, if I was nauseous or vomiting, if I had difficulty breathing, or I just had some general discomfort.
Okay, good. So yeah, I really can't imagine, what you guys are going through right now, but, rest assured we're going to be with you, through the whole process. And I also do have a pamphlet right here that could, help you with any questions or concerns you have, and feel free to talk to us anytime.
Alex, you're Catholic, aren't you?
Yeah.
I've seen that some hospitals provide pastoral care. Is that something that you guys do here?
Yeah, well, spiritual guidance is definitely going to be an important part of your treatment and recovery, especially for those who are religious. On the premises, we do have a priest, so I can arrange some meetings with you and him throughout your treatment. So
That sounds great. Thank you for accommodating us.
yeah, I know. Is there anything else I can help you guys with?
No, I think that's it.
I think we're okay.
All right, well, let's do this, guys. You got it, right?
Thank you.